So some common injuries that you see in tennis, the main one that I see a lot are rotator cuff injuries. So, you know, tennis is a lot of shoulder, serving, all the ground strokes. You have to be really strong in your shoulder. So if you're not, then the rotator cuffs get strained because they're the main ones keeping your joint in place right here too. So if they get weak or some of the times it gets torn, you have to get surgery or you might have to do a lot of physical therapy. But what I have patients do is they come see me, and a lot of times I love to do acupuncture in the rotator cuff joint. So putting points, you know, in the shoulder joint here. Sometimes I have them seated or I have them face down so I can do some of the points in the back as well. So if they come to me for acupuncture treatment, that's really easy to do. I use other points in that way. Sometimes I even use electrical stimulation, which is really helpful if it's super tight or there's a lot of pain in the rotator cuff joint, or rotator cuff muscles and the shoulder joint in general. And I also work in the neck area. So the neck and the shoulders are closely connected. So I always feel around how the neck is doing, the upper traps, making sure that they're not overusing this. So I also will use cupping. Cupping in the area is really helpful to increase the blood flow, getting rid of inflammation in the area. So I'll do that after the acupuncture treatment. And then if it's still sore, I also give them, depending when they see me, if it's chronic injury, this is more warming, the Hong Hu drill, which I've made before. There was a YouTube video where how I made it. So they can spray this on 2-3 times a day. There's also the tendon lotion, which I talked about before. So the tendon liniment here that they can put on, you know, 2-3 times a day. Or if it's more acute, if they just injured it, it might be swollen, very painful, then the good old JIAO is the one to use. So these are more acute injuries, or used for more acute injuries, and you can apply it 2-3 times a day onto the shoulder joint. So those are my treatment strategies to help with rotator cuff injuries.